So let me ask Mr. Kennedy again. If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
I'm going to make America healthier than other countries in the world right now.
Will you guarantee do what every other major country does? That's a simple question.
And by the way, Bernie, the problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry.
Oh, no,
and protecting their interests.
Oh, I thought that would come. No. I ran for president like you. I got millions and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry. They came from workers.
In 2020, you were the single largest
because I had
receiver of pharmaceutical money
from workers all over this country. Workers,
you were the
not a nickel from corporate
Bernie,
PACs.
You were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right.
Why have civilians been killed in Gaza? Because they hide weapons in hospitals, in schools, in homes. Hamas is the enemy, not our greatest ally, which is Israel. I was just there 2 weeks ago. 2 weeks ago, I was there. You know, there's almost no Israeli that hasn't seen a mom, a dad, a son, a grandson, granddaughter that hasn't been either injured or killed to protect their country. The fact that we are disparaging our greatest ally at this level is completely outrageous. I had plans to go home, see my wife and kids. But I rose today because I cannot stay silent after listening to that kind of nonsense spewed here in the United States Senate. It's a disgrace, and we should not ever forget that Israel is fighting the war that we would otherwise fight. And with that, I yield the floor.
What the gentleman did not tell us is whether or not he thinks it's a good idea for U.S. taxpayers to be spending billions of dollars on an extremist government in Israel whose stated policy is to starve children. Whether or not he thinks it is a good idea to cut off all humanitarian aid getting into Gaza right now. No medicine, no clean water, no health care facilities open. So the issue is not who started the war. Everyone knows who started the war. The issue is whether you commit war atrocities, criminal war acts, by punishing an entire people for the acts of a terrorist organization. The reason for this hearing, to be frank, is that my Republican friends understand they got a political problem. And what is their political problem? Their political problem is that all over America today, people on the Affordable Care Act are opening up packages coming from the insurance companies, and guess what? Their premiums on average are doubling, in some cases in my state, tripling or quadrupling. And if I'm a Republican, frankly, I don't want to go back to my district and explain to people why their ACA premiums are doubling or tripling. So, Mr. Chairman, yes, the current system is broken. Yes, we need to create a new system. But unfortunately, we aren't going to do it in 2 weeks. You're not going to undo the current American healthcare system. So what should we do? Well, what common sense would suggest, okay, you got a broken system, but you and I think, agree, you don't want to see people seeing a doubling in their premiums. So let us extend the current ACA tax credits for at least another year, 2 years, 3 years, while in fact, and I'd love to work with you on this, in this committee, we tackle the real issues. And by the way, if we're going to tackle the real issues, the first thing I think that we should do, Mr. Chairman, and I mean this very honestly, is have a panel with people from different countries around the world who are, A, providing health care to all of their people as a human right, and we are the only major country on earth that does not do that, and say to the people in France, in Japan, how do you manage to provide quality care to all of your people at half the cost that we do in the United States? What can we learn from other countries? I think that would be the first approach, and we can argue from there. But anyhow, I think the immediate task is to, as bad as the current system is, we don't want to see a doubling, tripling of premiums. We got to extend those, and then let's sit down and develop a system that works for the American people, not the insurance companies, not the drug companies. In my view, in Dr. Fagan's view, the answer is, in fact, going to be to emulate what many other countries do, guarantee health care to all people by extending Medicare in this country, Medicare for all. Mr. Biscagnano, in your opening remarks, you mentioned that last year the Inspector General reported that the error rate in Social Security was less than 1%, and it was an error rate that you wanted to improve upon. Am I right?
Yes.
Okay. But in his State of the Union address, listened to by millions and millions of Americans, President Trump suggested that, quote, millions and millions, end of quote, of Social Security checks are going out to people who are between the ages of 140 and 360 years old. Millions and millions of checks. You've just acknowledged what is true, is that the error rate in Social Security is less than 1%, 99 point whatever of the people who get the checks paid into the system and deserve those checks. So what I want to ask you is, do you think that President Trump was just expressing an outrageous lie, which I happen to believe, trying to undermine Social Security, or was he just grossly uninformed about the reality?
I think what the president was representing, which further was represented again and proven to be accurate, is that there were millions of Social Security records that did not have people deceased.
Let's not play with words. What you have just acknowledged is that in 2024, the Social Security Administration paid out over 99 point whatever percent to people eligible. The error rate was less than 1%. Millions and millions and millions of people 200 or 300 years of age did not get checks. Is that true?
What I represented was that a 1% error rate in a mission-critical function like Social Security is way too high.
I agree
and
with you. Excuse me, I don't have much time. Sorry.
Sorry.
President said millions and millions of people. You're saying, and you're right, less than 1%. You want to improve it? You're right. Let's do it. President was lying. And what he was trying to do was undermine the foundations of Social Security by saying the system is out of control. All right, my next question is, Senator Daines made a good point. You call up Social Security today, it's a disaster. Why, if right now it is hard for people to get through in Vermont and all over this country, why do you think the Social Security Administration is now closing down offices and laying off 7,000 employees? And we have heard from Mr. Dudek that he wants to cut up to half of Social Security's workforce. When the department is now understaffed, people can't get through. Do you think it makes sense to lay off half the staff?
First and foremost, I'm not there, sir.
Just answer the question, please. Do you think it makes sense? I know you're not there. Do you think it makes sense to lay off half of the staff when right now it is at a 50-year low in terms of staffing?
Well, I don't know where Mr. Dudek gets his information from, and I don't communicate with Mr. Dudek.
I'll just ask you. I mean, I think what Mr. Senator Daines said was right. Tough to get through right now. I think common sense would suggest that when it's bad now, you don't lay off half your staff. Would you agree with me?
I believe that we can drive efficiency for the rest of our life.
Right.
I also understand that it takes 20 plus minutes to answer the phone.
On a good day.
Right. Well, that's the average published, right? It's not how I would report the numbers because I think,
All right, but all that I'm asking, when you have a system that is not working now, do you think it's a great idea to lay off half of the employees?
I don't know if, do I think it's a great idea to lay off half of the employees when a system doesn't work? I think the answer is probably no.
Okay. All right, now I want to ask you another question, more philosophical, if you like. I understand, correct me if I'm wrong, and you made $100 million recently in compensation in a given year? All right, my question is not to deal with that per se, but right now, we have 22% of seniors are trying to survive on less than $15,000 a year. A lot of people, older people, living in desperation in America. Some of us want to expand Social Security benefits because we think people should not be living on $15,000 a year. We're concerned about the solvency of Social Security. We want to extend it beyond where it is right now. Do you agree with me that it does not make sense for somebody like yourself who makes $100 million a year in compensation to be paying the same amount into Social Security as somebody who makes $176,000? Or would you work with me to raise that cap so more money can come into the system?
I know there's an actuarial function in the area. I know it's analytics. I'm a fact-based, rule-based person. I'm happy to study anything and work side by side with you, sir.
All right, all that I ask, in general right now, the system is stressed
I'm sorry?
financially.
I'm sorry?
The system is stressed now financially. We want to increase the solvency and increase the benefits. Is it a good idea to remove the cap, which is now at, I think, $174,000, so that wealthy people contribute more into the system?
I don't think that's the commissioner's job at all, sir. I think the commissioner's job is to run the agency right. I'm happy to provide all the information you want, and I'm happy to be a partner in solving every problem.
Okay, thank you very much. Mr. Zeldin, thanks so much for coming in the office the other day. I enjoyed our chat. Mr. Zeldin, 2024, as you know, was the hottest year in recorded history. The past 10 years have been the hottest 10 years on record. We have seen in recent years unprecedented firefires in the West Coast and in Canada, and we're seeing the horrific situation in LA right now. We have seen unprecedented flooding in China, displaced millions of people there, unprecedented drought in Brazil, Africa, and elsewhere. And in Southern Africa, people are dying because of the drought and their inability to grow crops. Billions of people have been sweltering in Europe and elsewhere in unprecedented heat waves. In the midst of all of that, President-elect Trump has said that climate change is a hoax. You will be, if confirmed, one of the leading spokespeople in this country, representing us throughout the entire world. Do you agree with President-elect Trump that climate change is a hoax?
Well, first off, Senator, it was great to meet with you as well. I believe that climate change is real, as I told you. As far as President Trump goes, the context that I've heard him speak about it was with a criticism of policies that have been acted because of climate change, and I think that he's concerned about the economic costs of some policies where there's a debate and a difference of opinion between parties.
I would respectfully disagree with you. I think he has called it a hoax time and time and time again. And I would just say for the record that, and let me ask you this question, all right? Some of us have used the word existential threat. What we're seeing in LA right now is apocalyptic, and the other terrible weather disturbances, whether in the Midwest of this country, whether in many states that are represented right here. Unprecedented floods in my small state of Vermont. We've been hit over and over again in recent years. Our state capital, Montpelier, was underwater recently in a way that we have not seen. Would you describe climate change as an existential threat, meaning that there must be an urgency to get our act together, to address it?
Senator, we must, with urgency, be addressing these issues. And today, as we talk about any way at all that the EPA can do its part to make sure that our air and water are cleaner, healthier,
Staying
and
on
safer.
one, look, EPA has enormous responsibilities over an enormous number of areas. I'm focusing on picking up what Senator Whitehouse said. I worry very much. Do you have kids?
Yes, Senator.
Okay. I worry. Many of us have kids. We have grandchildren. This is serious stuff. This is beyond politics, my friends. This is the future of humanity. And if we do not get our act together, and that is not just the United States of America, this requires international cooperation. So let me ask you another difficult question. If tomorrow, magically, the United States Congress did all of the right things, that would not be enough. Climate change is a global crisis. It requires the cooperation of China, Russia, Europe, Latin America, etc. Are you prepared to represent the United States aggressively with some of your colleagues in reaching out to countries all over the world to cut carbon emissions?
Senator, it's very important for I, as administrator of EPA, whether traveling to the G7 or the G20 or elsewhere, to be reaching out to these other countries to make sure that there is a pressure on other nations to do their part as well. And it is my job to stay up at night, to lose sleep at night, to make sure that we are making our air and our water cleaner.
All right. I know it's fashionable to be beating up on China. It's good politics. They are now the major carbon polluter in the world. We have historically had that role. We're now number 2. We're not going to solve this crisis without working with China. Are you and hopefully your colleagues, if you are confirmed, prepared to work with China to try to lower carbon emissions?
Senator, on many different issues, it is important not just to be working with nations that we are the strongest aligned with, but to also be in communication with and engaged in dialogue with countries that might be considered competitors and also our greatest adversaries. And right now, China is an adversary in many respects.
Okay. I, as part of the IRA, had a provision in there for, I believe, $7 billion to lower electric bills for working class people all over this country by helping them install solar panels on their roof. We did it, my wife and I did it in our house. Our electric bill went down by 80%. Problem is many working class, lower income people can't afford the initial cost to install the solar panels. That's what this bill does. Can I have your word right now that you will work with me to make sure that Solar for All program is rapidly and effectively implemented all over the country?
Senator, it is my obligation on this and every other law enacted by Congress that I will follow my obligations under the law. And when it comes to spending money, it is important that I have the ability to sit before you and account for every dollar that's being spent by the EPA. So I know that this is an important priority of you and solar power.
Sorry.
That's okay.
Almost saved by the bell.
That was the fossil fuel industry.
I look forward to working with you on this, Senator.
Thank you, Madam Chair. Thank you very much.
Thank you.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much per capita on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm going to suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right. Is health care a human right?
In the way that free speech is a human right,
Yeah.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. And so are you guaranteed the same right,
And if
or
I-
is
okay,
there also
look,
a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right. You've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it,
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts. I
We're
question
paying
it.
10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right,
And
you believe that, all right,
is
you
what
think
I'm-
that you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
my job here is to make
I'm just
Americans
asking you that,
healthy.
Mr. Kenny, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few
Leadership.
months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with
Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will I want good science, and I want to protect the
But you will
vaccine
not
mandate.
tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman. Mr. President, we are now in the 38th day of a government shutdown. That means that federal employees all over this country who have to feed their families are not getting paychecks. It means that air traffic controllers are forced to work crazy hours, and we worry about the safety of our flights right now. We worry about Capitol Police officers right here in D.C. having a hard time feeding their families. These are hard-working people who are doing important work. They deserve respect. They deserve to be paid. This shutdown must end as quickly as possible. And on top of the fact that we have hundreds of thousands of workers not getting paid, we now have a president who, for the first time in the history of this country, is willing to allow our kids, low-income, working-class children, to go hungry in order to try to make a political point, a point, by the way, that the American people are seeing through. Mr. President, the cause of this shutdown is not complicated. For the first time in ever, the majority party in the Senate, which needs 60 votes to pass a budget, is refusing to negotiate. It is their way or the highway, take it or leave it. We got the majority, we're not talking to you, despite the fact that they only have 53 votes. And to make this situation even more absurd, and to show the American people the contempt in which the Republicans hold for negotiations and democracy, you got a Speaker of the House who has now given his members a 6-week paid vacation. Country is in the midst of a major crisis. Republican members of the House are nowhere to be seen. They're on a paid vacation. And if that doesn't tell you everything you need to know about whether Republicans are willing to negotiate, I don't know what will. Mr. Speaker, everybody in this country knows that our current health care system is broken. They know that we pay by far, not even close, the highest prices in the world for health care, while some 85 million Americans are uninsured or underinsured. They know that we are the only major country on earth not to guarantee health care to all people as a human right, something which must change. And what they also know is that Donald Trump and the Republicans, through their horrendous, big, beautiful bill, are making a broken, dysfunctional health care system even worse, taking it to the verge of collapse. That legislation is doubling premiums for over 20 million Americans who are in the Affordable Care Act exchange. And in my state, we are hearing from Vermonters who are being asked to pay a tripling of their rates and even a quadrupling of the rates. Who, in God's name, at a time when health care costs are already so high, can afford a doubling, a tripling, or quadrupling of their rates? That is insane. Nobody in my state, or I expect in this country, can afford to pay that. Further, that big, beautiful bill would throw 15 million people off the health care they now have as a result of massive cuts to Medicaid and the Affordable Care Act. According to studies, that would result in some 50,000 Americans dying unnecessarily every year. Low-income, working-class people who have chronic illnesses who will no longer be able to get health care. That is what we are being discussed. Anybody think it's a good idea to allow 50,000 of our fellow Americans to die unnecessarily each year? And all of this is being done in order to give $1 trillion in tax breaks to the 1%. No, Mr. President, I do not believe that Elon Musk and Mr. Zuckerberg and Mr. Bezos and the other multi-billionaires deserve $1 trillion in tax breaks in order to throw 15 million Americans off the health care they have and double premiums for over 20 million Americans. I don't believe that. The overwhelming majority of Republicans, Democrats, Independents don't believe that either. Mr. President, the American people understand that the Republican Party controls the White House, they control the Senate, they control the House of Representatives. And understandably, for that reason, poll after poll shows that Americans hold the Republicans accountable for this shutdown. But it's not just polls. On Tuesday, there was an election in which Trumpism was overwhelmingly rejected from Maine to California and a lot of states and cities in between. And one of the key reasons is that Americans want Democrats to make certain that they do not experience huge increases in their health care premiums or get thrown off the health care they have. That is what they are saying. We cannot afford a doubling or tripling in our health care costs. Stand with us. That's what that election was significantly about. President Trump claims to be a deal maker. In fact, he wrote a book called The Art of the Deal. Well, Mr. President, the ball is in your court right now. Help negotiate a deal. Show us what a great deal maker you are. Help us negotiate a deal which protects the health care of tens of millions of Americans, and let us end this shutdown today. We can end it in the next few hours. So, Mr. President, that is what this struggle is about. That's what this shutdown is all about. It's whether Republicans succeed in making a broken and dysfunctional health care system even worse by making health care unaffordable for working class and middle class Americans. It's about whether millions of our fellow Americans no longer have health insurance and that many of them will die unnecessarily. So, Mr. President, we are hearing right now, every one of our offices are hearing tragic stories of families having to decide whether they can pay for their parents' cancer treatment, for example, or whether they will see a parent die without that life-saving care. There are millions of Americans now dealing with chronic disease. They're dealing with cancer, they're dealing with diabetes, they're dealing with Alzheimer's, they're dealing with with heart disease. And they are wondering, if they get thrown off of health care, premiums go so high, how are they going to stay alive? How are they going to take care of their parents, their kids? That is what this shutdown is about. And whether it is in Maine, New Hampshire, Nevada, or Vermont, the American people want us to stand with them. And that is what this whole debate is about. We cannot fail the American people. They are looking to us to make sure that they continue to have health care. Let us not betray them. Thank you.
Let me very briefly, and I don't have a lot of time, ask the panelists very briefly, yes, no. Should the United States, in fact, join every other major country on earth, guarantee health care to all people as a human right? Mr. White?
I think the experience we've seen in every other country is that it doesn't work well.
Doesn't work well, huh? Ms. Strauss?
I would say, looking at the way the ACA has worked for us, absolutely not. This is the
Okay.
first indication that it will not work in the
Dr.
United States.
Fegan, you've studied other countries around the world. Mr. White says they don't work all over the world. Countries want to join the United States, see a doubling of their health care costs, and deny millions of their people without health care. Is that what the trend
You
is?
should ask the
Okay,
people with
Dr.
the
Fegan,
conditions in those countries
Ms.
how they get
Strauss, you
treated.
had your time. Dr. Fegan?
Yeah, every other country has managed to cover over 99% of their population, and their life expectancy is longer than ours, and they spend half as much as we do. We absolutely should do it.
Dr. Fegan, the Nonpartisan Congressional Budget Office has estimated, and this is really the important point. You want to talk about affordability? The CBO has estimated that Medicare for All would save the American people $650 billion a year. $650 billion. That's an enormous amount of money, and provide comprehensive health care to every man, woman, and child. That's not me. That's the CBO. When we talk about an expensive system, current system, we're talking about enormous amount of waste and bureaucracy in administering hundreds of separate plans. She has a $10,000 deductible. I have a $5,000 deductible. You have no health insurance. Dr. Fagan, based on your experience, what does that mean, the complexity of the plan and the cost of the plan and the impact on patients who walk into your office?
Patients can't figure out how to access the care they're entitled to, and as a result, they often don't get the care they need. We could save billions, as you indicated, hundreds of billions of dollars, and we know that over 50,000 people a year die as a result of not having health insurance.
As you well know, everybody here knows, Trump's big, beautiful bill is going to throw approximately 15 million, more or less, people off of Medicaid. These are low-income and working-class people. And that decision was made in order to give $1 trillion in tax breaks to the top 1%, Mr. Musk, Mr. Bezos, and others. What happens when you throw 10, 15 million low-income and working-class people off of the healthcare, off of Medicaid healthcare they have now?
When we take away health insurance, people die. It's just that simple. People do not get preventive services. They do not get the basic problems that we know how to treat. Their diabetes becomes uncontrolled. Their hypertension results in increased strokes. We know that people have greater disabilities. We know that working class people will make decisions that will mean skipping their health care until they are desperate and come into the emergency department. And at the time that they present with their illnesses, we'll be forced to take care of them, and it will cost us more. It costs us more to take care of the stroke. It costs us more to put patients on dialysis. It costs us more when patients have diabetes and that's out of control and then we have to amputate limbs. We know that eventually they'll come into the emergency department, and COBRA requires that we take care of them regardless of the cost. And so we're costing ourselves more at the back end, and we're losing contributing members of society.
Which raises the question of why we spend approximately half as much per capita on primary health care, disease prevention, as other countries. If I'm an insurance company, do I want to really invest in keeping people healthy? Is that where I make my money?
The United States has about 0.3 primary care physicians per 1,000 patients in this, and every other country has over at least like 0.8 or 0.7 primary care physicians per 1,000. So we don't produce enough primary care physicians to take care of the population at this time.
And we underpay those physicians as well.
We do.
You say as a primary care physician, right?
As a primary care physician.
Just so everybody understands, you and I, a couple of years ago, were in Toronto, as I recall, right?
That's correct.
Okay. And the doctors there were telling us they do major surgery, good quality care. What's the bill when somebody comes out of a major procedure at a Canadian hospital? How much are they going medically bankrupt?
Absolutely nothing.
Nothing.
And matter of fact, we visited the billing
And how much
office.
do they spend per capita compared to us?
They spend half as much.
There you go. All right.
But
Maybe
they're
we
4
should
years
study.
longer.
Maybe we should study that. Mr. Secretary, did I hear you correctly to state that your goal is to have Americans pay the lowest prices in the world, or equivalent to what is paid in other major countries? That is my goal. That you are prepared to work with us on legislation to achieve that goal.
Absolutely.
All right. And I believe there's bipartisan support for it. I believe that if the leadership here prioritizes that, we can do that in a very short period of time. Look forward to that. Let me ask you this, as Secretary of HHS. We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America?
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to, I don't have a lot of time, so but I am here.
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's a problem.
It's not like freedom of speech, which costs, everybody.
But every other country, Mr. Secretary, every other country guarantees health care to all people as a right. Should we, as Americans?
The objective is to get Americans the level of health care that they want, the choice which Americans want.
They don't want the choice to be uninsured.
Well, but
They don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe, okay.
And what I would say is, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the...
Sorry to interrupt you. All right. The reconciliation...
My job is to try to make it work.
All right, I have limited time. The reconciliation bill that is now being worked on in the House will come to the Senate. As it stands right now, cuts Medicaid in the Affordable Care Act by more than $715 billion, which the CBO has estimated would eliminate health insurance for 13.7 million Americans, and also raise co-payments for millions of others, is throwing 13 million Americans off of the health care they have, poor and working class people, keeping America healthy.
Well, I haven't seen that number. I've seen the number 8 million. And here the people, the cuts are not true cuts. The cuts are eliminations of waste, abuse, and fraud. And I can go through. I can go through the people who will lose it. There are a million people,
I really don't mean to be rude, but as you know, I have a very limited amount of time.
You asked the question, I'm going to answer it.
Well, yeah, I've got a bunch of questions that I would like you to answer as well. All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with proposals from the president. The president
No, I'm talking
is
about
not
the
making
congressional
any-
bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how many
estate
people,
tax.
how many billionaires do you know that are making overtime or making any part of the tips?
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny
Congressional bill.
the top 0.2% will get $235 billion in tax breaks while we cut Medicaid.
Okay. Senator Paul.
Let me get cut to the chase, and I'll try to be brief here. We hear a lot of talk on the floor of the Senate about patriotism, about love of country, about how we have all got to work together for the common good. And it would seem to me that when we talk about those who sacrifice, those who have put their lives on the line to defend this country, we're talking about the men and women in America who are veterans. And yet, what we have seen in the last month from the president and from Elon Musk is a chainsaw approach to essentially destroy the Veterans Administration. And that is, there are plans afoot, public, no one is debating the numbers. They want to fire 83,000 employees. And when you fire 83,000 employees, nobody believes that anything else will happen, but that there will be a deterioration in the quality of health care that our veterans receive, or a delay in the benefits that they have earned. Now, I've heard criticism of the VA. VA is the largest healthcare system in America. Is it perfect? Absolutely not. Does it have its problems? Of course it does. But compared to what? Compared to the American healthcare system, which is the most expensive in the world, a system in which 83 million Americans are uninsured or underinsured, where 60,000 people die each year, where we have the lowest life expectancy of any other major country on earth. So no, the VA is not perfect. It needs improvement. But I will tell you that in the state of Vermont, I talk to a lot of veterans. I'm the former chair of the Veterans Committee, and I've had the honor to look to veterans of Vermont and all over this country. And in Vermont, what they tell me, there is enormous pride in the quality of care that they get at the VA Medical Center in White River Junction, Vermont, and as well in the community-based outreach clinics that exist all over our state. And I expect, with some exceptions, that is true all over the country. Bottom line is, veterans appreciate the care that they get at the VA. Want it improved, but they appreciate it, and they do not believe that there should be massive cuts to the Veterans Administration. Truth is that in fiscal year 24, before Trump took office, the VA reported over 36,000 vacancies, including 2,400 doctors, 6,300 registered nurses, 1,800 social workers, and 1,200 custodians. When you have a workforce shortage, the solution is not to fire 83,000 people. It is to add people. It's to make sure you know where your workforce is going, that you have quality people, but you don't lay off 83,000 people. That's not just my view. It would seem to me that before you take a chainsaw to the Veterans Administration, you might want to talk to the veterans organizations and see what they think about it. The Veterans of Foreign Wars, VFW, said, quote, "We call upon VA to reconsider its planned reduction of 83,000 employees and thoroughly review any proposed cuts prior to rolling out further announcements like this," end quote. Paralyzed Veterans of America said that they are, quote, "deeply troubled by actions being taken in Washington, D.C. that are already having a detrimental impact on the services that veterans with spinal cord injuries and diseases like ALS and MS rely upon," end quote. The Disabled American Veterans, the DAV, said, quote, "We are extremely concerned about the leaked proposal to arbitrarily eliminate 80,000 VA employees," end of quote. That is what some of the major veterans organizations are saying, and I've talked to virtually all of the veterans organizations, and they are deeply, deeply, deeply concerned about the cuts that we have seen and the cuts that Musk is proposing. So, Madam President, this is not a difficult issue. Everybody here wants to make the VA more efficient. The way you do that is to come up with some plans. You work with the Veterans Committee, and you see how we can make the VA more efficient. Nobody in their right mind thinks that just firing 83,000 people is the way to go. And let me be very clear. Mr. Musk has made it public that he thinks that we should privatize anything that can be privatized. There are people, not all, people in the Republican Party who eventually want to privatize Social Security. We're looking at $880 billion in cuts in Medicaid to dismantle that very important health care organization. And if anybody thinks that the laying off of 83,000 employees of the VA, the lowering of quality care that our veterans will receive, is not a prelude to the movement to privatize the VA, you would be surely mistaken.
The senator from Alabama.
Reserving the right to object. You know, November the 5th, President Trump was given a mandate. Get this country straightened out. This included waste, fraud, and abuse in our federal government over all agencies. The VA is a perfect example. Under President Biden, the VA increased its staff 80,000 employees in 4 years. Let me repeat that. Under President Biden, the VA increased its staff 80,000 people. You'd think that this would mean that we would increase the efficiency of our VA 80,000%. Unfortunately, that's not the case. Despite the Biden administration ballooning the size of the department, the VA has nothing to show for it, In fact, wait times and backlogs have gone up. Hadn't worked. So these cuts are not warranted. They are completely necessary. By reducing the number of employees, these savings can be redirected to actually providing veteran health care and benefits while still protecting VA's mission of critical jobs like doctors, nurses, and claims processors. Do the job it was meant to do. And phasing out non-mission critical jobs like DEI officers and interior designers, for just a few, is necessary to get this job done. Now, I don't want to oversimplify this. I know these problems at the VA exist. They always have existed. Since 2015, the VA care has been on the government accountability list. High risk. That means it's being audited. Are they doing their job? Not very good reviews. We have to do better for our veterans. I come from a military family, spent many hours in the VA. Some are good, some are not so good. Let's stand up for our veterans. The VA challenges across the board, from overseeing simple things like safety and access of care, are essential. And it's not by having more people, it's by having better people. The VA is not supposed to be a massive bureaucracy. That's not what it was meant to be. It was created to serve our veterans. This resolution being put forward would directly prevent President Trump from carrying out his mandate that the American people gave him. American people have spoken, and the days of business as usual are over. The VA is going to get better. For these reasons, Madam President, I object.
Objection is heard.
Madam President,
The senator from Vermont.
I am not aware that in the so-called mandate of President Trump, and by the way, he got millions of votes less than Joe Biden got 4 years previously, I don't recall that during the campaign, Trump went around the country saying, hey, elect me, I'm going to lay off 83,000 workers at the Veterans Administration. Yes, we all want the VA to operate more efficiently, but the idea that you can lay off 83,000 employees and make that happen is absurd. The truth is, again, before Trump took office, we had a significant shortage in the number of doctors, nurses, mental health counselors, and other practitioners. So it is disturbing to me that anyone who claims to be supporting veterans in this country and the sacrifices they have made would object to this amendment, this resolution. And with that, I would yield the floor.
Do you support the PRO Act?
Thank you, Ranking Member Sanders, and I appreciate the conversation. I support the American worker. President Trump.
Okay, I don't mean to be rude.
No,
we
you're
don't
not
have
rude.
a lot of time. I'm gathering that you no longer support the PRO Act, is what I hear. That you support the American worker. That's what everybody here will say. Ms. Chavez, Dreamer, in 2021, President Biden signed the Butch-Lewis Act that prevented the earned pension benefits of some 2 million union workers and retirees from being cut by up to 65%. There are people in Congress who want to undo that enormously important legislation. What do you feel about the Butch-Lewis Act?
I support the Butch-Lewis Act in protecting their retirements.
And you will go to the wall, to go to the mat supporting it?
I do support protecting people's retirements.
Federal minimum wage is 7.25. State after state has voted to raise the minimum wage. Somehow we can't do it here in Washington. 20 million workers are making less than $15 an hour. Do you support raising the minimum wage to a living wage?
Ranking Member Sanders, you know that that is an issue for Congress to determine and raising the minimum wage. As the Secretary of Labor, I cannot weigh in on that. That's determined by Congress. If they want to negotiate that, I will fully and fairly enforce the law as a Labor Secretary, if you all so choose, and give you whatever data possible to make that decision as members of Congress.
Well, I understand that Congress makes the law, but you have an opinion, and you will be the leading advocate for workers if you are confirmed. Question, if you were sitting where I'm sitting, would you vote to raise the minimum wage to a living wage?
Well, I'm not sitting where you're sitting hypothetically. I used to, but not any longer. But I do recognize that the minimum wage hasn't been raised since 2009, and the cost of living has gone up. But again, I cannot sit here and determine what that wage will be fully and fairly. I will enforce the law, but it will be up to Congress to determine because that is not in the purview of the Secretary of Labor. For instance, in Oregon, I know that in Portland, Oregon, that the minimum wage is almost $16 an hour, and that might work for Portland, but that's not going to work for Grants Pass, Oregon. And I know that local communities, states determine what's best for their economy. What we don't want to do is shock the economy. But again, sitting here today, I cannot determine as Secretary of Labor if it should be.
Chavez Dreamer, in his second week in office, President Trump fired Gwynne Wilcox, a member of the National Labor Relations Board, leaving the NLRB without a quorum. And what that means right now, that if workers form a union, vote to form a union, and the company says, well, I think that was illegal, it's unfair, you can slow up the process because there's nobody to go to. Do you believe that the firing of Ms. Wilcox was illegal? Which I do.
President Trump has a right to exercise his executive power, how he sees in consultation with.
Are you concerned that we do
team.
not have a functioning NLRB right now?
The NLRB is separate from the Department of Labor, but
understand
I
that.
do believe that the function of the NLRB is important, and I will always take that into consideration doing my
Are you
job.
concerned that we do not have a functioning NLRB now?
Well, again, I have not been read in with President Trump, but he has a right to exercise his executive power, and I do believe the NLRB has an important role, independent of the Department of Labor, and I respect their position as an independent agency.
Thank you.